Hello, myself Dr. Apratim Chatterjee. I am an interventional neurologist. So today we'll be discussing about stroke. So stroke in neurology is one of the most important and critical emergency, causing one of the commonest reasons for mortality and morbidity across the world. And most importantly, it's a preventable disease, and also once the stroke happens and you correctly identify it and reach the appropriate stroke care center, which has to be a comprehensive stroke care center providing both acute as well as chronic stroke care, your outcome of this mortal disease becomes remarkably benign, and the chance of patient improving and getting a new life is much more. So in such a center, we provide acute stroke care in the form of thrombolysis, which is an IV clot busting drug given through the venous channel, and it has to be given within 4.5 hours of the onset of stroke symptom. And there is also a facility of clot retrieval, which has to be done in a cath lab and which has to be done by a procedure called mechanical thrombectomy. It's an endovascular procedure in which we either use a stent to take a clot out of your brain, or we use a suction catheter to suck the blood clot out of the brain and restore the normal circulation. If this can be done in appropriately timed fashion and in a properly conducted selected patients, then the outcome remarkably improves, and sometimes we even may get improvement of your paralysis right on table or just within a few hours of onset of the patient. The time window now has shifted to the concept of tissue window, where we actually try to get an idea about how much of your brain tissue is at jeopardy, how much we have already lost. If we have a large amount of brain tissue which is still getting damaged but is yet to be damaged, then he is the appropriate candidate in which we can actually do the salvageable brain therapy. Not only acute stroke, even patients having previous strokes need to be evaluated as to the cause of stroke, because if you do not know the cause of his stroke might recur, and also the scope of rehabilitation is a huge important thing for these patients to come back to normalcy, to gain his normal functional life. So at Charnock, we have developed it into a comprehensive stroke center. We provide both IV thrombolysis and also cath lab associated neurointerventional facility in the form of mechanical thrombectomy for acute stroke management. Likewise, as I said, for chronic ischemic strokes as well as for hemorrhagic strokes, we have a proper rehabilitation therapy, proper functional therapy, speech and swallow therapy, along with the neurology follow-up, so that we can not only evaluate the cause of stroke as well as return the patient back to his normal functional life. Thanks a lot.